I'll be drawing a diagram for it. Just look into the question. Identify the current status. Okay, identify the current status if the solid line is in the normal condition. So for this we have to first know the diagram, okay, so that you can then actually understand the question. I'll be explaining you also. So this is suppose ICF and this is ECF. Okay, so this is the solid line which was being spoken about. This is the solid line, right? This is the solid line which I was speaking. Now a dashed line is being given to you, right? A dashed line is being given to you. Yes, this is the question. So this is the solid line which represents the normal status, okay, and this line which is a dashed line represents you the current status. So is this clear? This is my ICF, 2/3, 1/3 is my ECF, this is my normal status, and this is my current status, right? The lines are the current status, the dashed line. Now the question is, identify the current status if the solid line is normal. What it could be? It could be hypertonic saline ingestion. Okay, it could be hypertonic saline ingestion. It could be primary adrenal insufficiency. Primary adrenal insufficiency. It could be gain of hypertonic fluid, or it could be loss of isotonic fluid. So the question is, this is the question, that this is a solid line and this is my current status, and from this current status you have to identify the cause of this current status. So what is the cause of this status? Whether it is hypertonic saline ingestion, it is primary adrenal insufficiency, it is gain of hypotonic fluid, or it is loss of isotonic fluid. Right, now, so the correct answer is C, that is gain of hypotonic fluid, like drinking lots of water. Now what is the concept behind? I know this is something very new to us, but we can learn new things because day by day the question level is also going higher. Now this is my ICF and this is my ECF. We know that the ICF is more than ECF. Like this. This is called as the Darrow-Yannet diagram. Darrow-Yannet diagram. D-A-R-R-O-W Yannet. Okay, Darrow-Yannet diagram. Now this, on this diagram, the x-axis represents volume. The x-axis represents volume, and this y, it represents your solute concentration, or you can, in very simple way, you can say it is osmolarity. Okay, osmolarity or the solute concentration. Solute concentration, and this is volume. Volume which is, we have seen that it is the ECF volume and it is the ICF volume. Right? Now when drinking water, when just water is drank, you just drink water, what are you going to do? When we drink water, we have increased the ECF. Water will go into the ECF, not into the ICF. So you have increased your ECF. Therefore, the dashed line is going beyond the solid line. Is it clear? The dashed line is going beyond the solid line because we are drinking water. So water is added to my ECF. Now it is plain water. It is not having any solutes. So the solute concentration will be less or more. Okay. What will be the solute concentration? The solute concentration will be less. Okay. So the solute concentration will be less. That means this line will not go above the normal arrow. Normal जो हमारा current status था, जो हमारा normal status ये है, but ये जो है हमारी osmolarity वाला जो line है, it will be under this because I have drunken simple plain water which has not increased the osmolarity. I have not taken hypertonic fluid, I have just taken a hypotonic fluid. That means I have decreased the osmolarity. Clear? So what I have done, I have increased my ECF volume. How have I increased my ECF volume? I have dunk in water and I have decreased my ECF osmolarity. I have decreased my osmolarity of ECF. Now, when the osmolarity of ECF decreases, when the osmolarity of ECF decreases, what will be the direction of osmosis? Or what will be the direction of fluid? The fluid, that is the water, will always move from low solute to high solute concentration. Okay, from low solute to high solute concentration. Are you getting? The movement of the fluid, right, the movement of water will be from low solute to high solute. That means here will be my movement, this will be my movement. That means the fluid from the ECF will go into the ICF. The fluid from the ECF will go to the ICF. So what will happen to the ICF volume? The ICF volume will also increase. The ICF volume will also increase. So this is the answer. So when we are drinking hypotonic fluid, what we are doing, we are adding quantity to the ECF. We are adding quantity to the ECF. Now we have added quantity to the ECF, but we have not increased the osmolarity. So when we have not increased the osmolarity, we have just added water to the ECF. So the ECF volume has increased, but the osmolarity, see, the volume has increased, but the osmolarity has decreased. So when the osmolarity is decreased, water or the fluid will shift from the ECF to the ICF, and it will increase the concentration, increase the volume of ICF. So the volume of ICF will also increase. So can you see this? The volume of ICF was increased, the volume of ECF was increased, but what has happened? The osmolarity has decreased. So this is gain of, this should be not hypertonic, sorry, this should be gain of hypotonic fluid. Gain of hypotonic fluid, not hypertonic. This is gain of hypotonic fluid and not hypertonic. Gain of hypotonic fluid. Getting? Did you understand this concept? Now see, one important thing you should remember, that the tonicity of the ECF, will determine the direction of movement of fluid. If the tonicity of the ECF is more, the fluid will move from the ICF to the ECF. Okay, if the tonicity of the ECF is more, the fluid will move from the ICF to the ECF. But if the tonicity of the ECF is less, the fluid will move from the ECF to the ICF. So the tonicity of the ECF is determining the movement of direction of fluid, that whether the fluid will pass from ECF to ICF or from ICF to ECF. Now just take another example, okay? Just take another example so you will be cleared better. Let us take this example, a different example. Again, this is my normal status. Now just take ingestion of hypertonic saline ingestion. तो अभी मैंने क्या पिया था? हाइपोटोनिक. अभी मैं क्या ले रही हूँ? हाइपरटोनिक. What will happen? Suppose if we take hypertonic saline ingestion, that means again, if I have ingested something, that means the ECF will increase. So this my ECF has increased. Right? Hypertonic means ECF has increased, the volume has increased. Now it is hypertonic, that means the osmolarity will be more. right? Now, what is the difference now? This has become hypertonic, right? So the movement of fluid will be from the ICF to the ECF. The movement of fluid will be from the ICF to the ECF. Why? Because I have drunken hypertonic saline or a hypertonic fluid. So I have increased the ECF volume. I have also increased the ECF osmolarity. I have increased the ECF volume. I have increased the ECF osmolarity. Because the osmolarity of the ECF has increased, the fluid will move from the ICF to the ECF. The fluid will move from the ICF to the ECF. So now what you will get is this type of picture. You will get this type of picture, that is the ECF volume has increased, ECF and total osmolarity has increased. Here the ICF volume is now decreased. The ICF volume is now decreased. Why decreased? Because the osmolarity of the ECF was more and the fluid shifted from the ICF to the ECF. So this is the Darrow-Yannett diagram. Okay, it is the Darrow-Yannett diagram which explains us the movement of fluid, the direction of movement of fluid. The concept is that the tonicity of the ECF defines the direction of movement of fluid. The tonicity of the ECF defines the direction of movement of fluid. If the tonicity of the ECF is more, fluid will come from the ICF to the ECF. But if the tonicity of the ECF is decreased, the fluid will move from the ECF towards the ICF. What does tonicity depends upon? Tonicity depends upon the presence of non-permeant solutes. It depends upon the presence of non-permeant solutes, especially sodium chloride. So जहाँ पे भी sodium chloride will be more, water will go towards that direction in nutshell, and it is mainly the tonicity of the ECF which is going to decide. Hope you understood this concept and you liked it, and I hope it was an interesting and a different question from the routine ones. Okay.